Morning, everybody.
Good morning.
Everybody set? We okay? All good? Well, Fran and I had an opportunity to really watch this operation. It's quite an impressive operation. Just want to thank everyone who is making this happen every single day. The thing that we notice when we travel around the state, and it was very true again today, is that the people who are getting vaccinated really just feel good. They're very happy. There's a real sign of relief, feel of relief, and they are just very, very happy about it. So I want to maybe start with a couple statistics, and these are always now 2 days behind because I don't have today's in yet from yesterday's, so this would be from the day before. But in Stark County, over 87,000 people have been vaccinated from Stark County, 23.5% of the population. So that is not 23.5% of the adult population, that's 23.5% of the total population. So obviously we have a significant number of people who cannot yet be vaccinated. So that's a good number. The state numbers, I don't have them out yet for today. They'll come out in the next hour. I'll see them. But we have now passed over 3 million Ohioans who have been vaccinated. My last data is 3,028,000. That's about 26% of the population in the state of Ohio. Of those who are 65 years of age and older, we have now vaccinated over 2/3 of them. So that is a good number. Some of the age groups, for example, 80 and above, we're now over 70% of that age group. But we anticipate that will still go up. We talked to a gentleman out there just a moment ago who was getting vaccinated, and he said next would be his 93-year-old mother. He had not been able to talk her into coming in yet, but he thought he would get his, and then he thinks he'll be able to talk her into getting that vaccination. We really are at and we've said this several times, but this really is a critical time. We have a race going on. The race really is between how fast we can vaccinate people and the variant, which you're seeing in state after state. So we're seeing Michigan that has really had a significant outbreak now. We're also seeing that in parts of West Virginia. Ohio's case numbers have really plateaued. They were going down for the last several months, and we rejoiced every time we saw them go down. But now they have plateaued out, and our concern, of course, is that they may not only plateau out but start back up. So what we do know is that as we vaccinate people, we're basically taking them out of the game as far as individuals who can spread it very much or who will get it. So just encourage everyone to get the vaccination. If anyone had doubts, we've now had millions and millions of people across this country who've been vaccinated. So there's a real, you can see how it's worked. It's worked very, very, very well. So I'm going to ask our two health commissioners to come up and really kind of give you a report. Jim Adams, Canton Health Department, as well as Kirk Norris, Stark County Health Department. They have both done a phenomenal job, and I just want to not only thank them, but thank their teams. If you work at the health department, the last year has been a tough year. We've asked these health departments around the state, 113 of them, to do some amazing work, and they've hung in there, and they're making a difference every single day. So Jim and Kirk, why don't you guys come up? We'll stand back, and whoever wants to start can start, and we'll go on from there.
Jim. Collaboration and partnership.
Yeah.
Well, hello everybody. Thank you for coming. We are so very pleased and proud that the governor is here with us today, and First Lady. It's very surreal whenever you walk through our clinic or any clinic, Jim's clinic as well, and you just see the happiness on everybody's faces. boosts morale like you wouldn't believe. Our employees, I think Jim will agree with this, are exhausted mentally and physically.
But they are.
But the morale, when you have, you know, the 70 and older population that we were first vaccinating come in and just with tears of joy on receiving their first and second doses, just really, really boosts the morale of our team. So we are a collaborative county. We collaborate not only with the other 3 health departments, Jim's team, as well as the Alliance City and Massillon City health departments, but we could not have done this with my team without the Board of Developmental Disabilities, Mr. Bill Green and his staff. Mr. Green has allowed us to utilize some of his nurses and from the Board of Developmental Disabilities, as well as the beautiful facility that we have, as well as our MRC and our local law enforcement and sheriff's department. So just grateful for that and very proud of what we're accomplishing in Stark County.
Thank you, Kirk. First of all, thank you, Governor and Mrs. DeWine, for your support in all this effort. It's been a very, very long year, and we still have a ways to go before we're out of this, but I think we're on the right path for recovery. I would also like to echo Kirk's comments and really thank our staff for the work that they've done. This would not be possible without their continued involvement, and we've had staff that have been working virtually 7 days a week since last March in trying to help curb the issues around this pandemic. I also like to thank the community for their support. You know, unless they come out and are willing to get vaccinated and participate in what we can offer, we're not going to see the end of the pandemic. So really, really thank the support of our community and all of our community partners in making this happen. So thank you very much.
I also introduced County Commissioner Janet Creighton. Janet, back there. I don't know if we got any other elected officials here or not, but we're happy to answer any questions.
Governor, is there anything unique about this particular location, anything happening here that is particularly unique?
Well, certainly a very well-run operation. They're handling, how many a week? How many are you doing a week?
We do about 1,000 to 1,100 a week now. Or a week, I'm sorry, 4,000 to 5,000 a week.
And next week, you're getting how much?
Next week, we're getting almost 5,000 doses of Pfizer.
Of Pfizer?
We are full for next week as well, all of our appointment slots.
Okay, so you are, I want to make sure we get that out. You are booking basically a week ahead?
Correct, depending on our allotment that we receive from ODH, which is increasing
Right.
due to the amount of vaccine coming into the state. So thank you.
So this coming week, we have a significant amount of increase in the vaccine coming into Ohio. So it's, big, real significant increase. I think we're up to roughly 570,000 first doses next week, first doses. I only count the first doses because the second ones just follow. But so that's an increase from about 400 and some thousand this current week. So. But what is amazing as you travel around Ohio, and it's really true here in Canton, Stark County, is you have volunteers who are in there. You have people who are just literally making a difference. Fran and I stopped in Springfield a week or so ago, and there was the doctor, a retired doctor, who had delivered some of our babies, and you just see people who are, just volunteering. They're coming in. They're making it happen every single day. So it's an amazing group of people.
And with the growing number, Governor, of the individuals in Ohio who are getting their first dose, and the increasing numbers of vaccines coming in, will there be any challenges in getting that second dose to people, do you think,
No.
when they start needing it?
No. The last thing anybody should worry about is whether they get the second dose. Virtually every place that we've seen, when they get the first dose, they're given a card that tells them when to come back for the second dose. And the whole system that was designed very early on provided for that. So the federal government, when they send in that first dose, it's clocked in when that second dose is coming. So we've had no problem in Ohio in regard to the second dose. The only problems we occasionally have is somebody forgets and doesn't show up for the second dose. But you know, that's a rarity. So no, there's no problem there. Who else has questions?
Governor,
Yes.
there's clearly in the legislature, and probably many in the public are ready to move on, but that could pose a problem, as you said, with the plateau. Thinking ahead, what is the plan if the numbers don't start to come down and in fact go the opposite direction to deal both with the public health policy plus your own legislature?
Look, I think Ohioans are doing a very good job in regard to wearing masks. We track this every week. We did something that I don't know if any other state did. When we put out the mask order for retail, we followed that up with sending inspectors out from the Bureau of Workers' Compensation. And they've gone out, and they've not had to cite anybody or close any businesses. They've just very nicely explained to whoever is running the retail establishment that you had, look, people need to wear a mask in here. It's just the culture that you set up. We run every week, we're steady at 93%. 93% compliance statewide, smallest counties, biggest counties, all together, it's 93% of the people in Ohio are wearing masks when they go out into a retail establishment out in public. That is, I think, the reason that our numbers are not going up. And we're seeing other states' numbers go up. We've been very consistent in doing this. We also have really focused a lot on our older Ohioans. We started the first day with our nursing homes, but we did not stop in the nursing homes. We are now continuing to send doses into nursing homes, even though we've been through there 3 times. And what we're doing now is we want to cover a new employee in a nursing home, we want to cover a new resident coming into a nursing home, and we want to cover anybody who has changed their mind and decided that they want the vaccine. So that, I think, is also unique in Ohio. So those are the 2 things that I think have really made a difference. But we can't take anything for granted. These numbers, you're absolutely right, these numbers certainly could start going up again. But what we do know, and what the scientists tell us is, the faster we can vaccinate people, the better chance we have of keeping this virus down. So we have to reach the herd immunity. And we are now in a time when, beginning Monday, at all our sites around the state, people will be able, no matter what their age, basically, unless they're 15 and under, but everybody will be available to get the vaccine. So we just encourage people to do that, and we're now, frankly, working within our team to come up with different ways to really bring the vaccine to people. For example, we have people who might work in a factory who might not be able to get off during the day, so it's more difficult. So we're looking at ways to reach everybody, because it's the best interest of the individual Ohio citizen, but it's also collectively in our best interest to drive this virus down. Who else?
Governor, the mask obviously has been key to your success, but it's also become the political football. Are you planning to fight to keep any mandate or health restrictions, whether it's with companies or through the state, to keep wearing a mask? Because the push seems to be coming the other way to get rid of it.
Well, the bill that the General Assembly passed, that I vetoed, and they overrode the veto. The good news, frankly, is it does not go into effect for 88 days from now. I hope that this virus is in our rearview mirror in 88 days and before. And at the rate that the vaccine is coming into Ohio, it's not going to be too long until the challenge is not that we don't have enough vaccine. The challenge is going to be, convincing Ohioans who have been reluctant to get it, convincing them that it's time to get the vaccine. And that's just important. I think my experience and what we have seen, and we see it, frankly, when we go out and talk to people who are being vaccinated. People listen to their own doctor. They listen to their spouse, usually. They listen to their family and friends. that's who really has the influence. I mean, we talked to a man the other day, he said, I'm the first in my family to get it, but I'm going home and tell everybody that they need to get it. So that's how it's going to happen. It's not going to come from the governor. It's not going to come from, some elected official. It's going to come from your friends, your family, your doctor. So when someone says, I don't know whether to get it, I said, look, just go talk to your doctor. Because people generally trust their own doctors. So, we have to stay on defense for a while. I had a gentleman out there who said, get rid of the mask. But we're not there yet, but we're going to get there. And by using the mask and vaccinating at the same time, we're going to get there. And it's not too distant future. This summer is, the President talked about July 4th. I'll talk about Memorial Day. I think Memorial Day will be great. A lot better than it was last Memorial Day. I'm very optimistic, but we can't let up. We're like a football team, and we're driving against the opponent, and we're down to their 4-yard line. We can't walk off the field. We can't spike the ball and say, hey, the game's over. We got to just go drive and finish. So we got to finish the job, finish the work.
My last question, Governor. This morning we did have a report that Walgreens, because they lost power in Northeast Ohio, got hit a lot. Was then able to distribute the vaccine, which led us to wonder, are there protocols in place for that? And we don't know what happens to vaccine in that case. Does that mean they weren't refrigerated, or are there generators? Do you have any sense?
Well, they should. It's funny you said that. Our electricity went off in the middle of the night, and that was the first thing I thought. Oh, that's not good. We're going to slow down the vaccine today. Our electricity came back on, but look, they all have protocols, and you have to be a provider to do this. These people, everybody who's doing it, and by the way, we have 1,300 providers in the state now. 1,300 people, 1,300 groups, places where Ohioans today can get the vaccine. And what we're adding, and we'll be adding next week, are more mass vaccination sites. So there will be one in Akron, for example. Some of the sites like here that are not, quote, mass vaccination sites, they really are. It's just a label, and they're seeing an uptick. So, but everybody's supposed to have a plan, and what we would assume that they would do is just cycle that right back in, and get those people who maybe they had to miss that appointment, just get them an additional appointment.
Thank you.
Anybody else? Okay. Well, everybody good? Okay. Thank you all very much. Good to be with you all. Yeah, absolutely. I'll do it. Where are you going to go?
I know precisely what you're, I know, yeah. I think they met you before.